Good morning, everyone, and welcome to this webinar and Q&A around cannabis referendum. My name is Marion, and I'm the CEO of Platform Trust. And for those of you who don't know Platform, we're an organisation which champions the community sector in New Zealand to be a positive place for people with mental health issues and addiction issues to live and to work and to have a good life. So the purpose of today is to really share some of the uncertainties, the questions that we have had raised through our membership, to answer some of the questions that people are asking. So we have worked with our colleagues, and thank you very much, from the Drug Foundation to help us unpack some of these the issues and the questions that people have raised. So we want to stimulate debate. Our position is not to have a position to whether it's yes or no. However, we really want to give everyone the best evidence that they possibly can to inform their decision, but also to raise some of the questions that people have about the impact that this may have on the people that they know or the services they run. We want to, I'll just give you a quick housekeeping. We're running this through a Zoom. There's a chat feature, and we really encourage you to introduce yourself, say who you are, what you're thinking, ask any questions, and there's people moderating that so they can answer the questions or direct you in the right way. There's also the opportunity to ask questions on a Q&A process. So what we'll try and do is we'll look at those questions as they're coming through. We've already got some questions that have been raised by our members. So we've got moderators on hand. We've got a techie guru on hand. So yeah, welcome to this ride. Enjoy yourself and use this as an opportunity to pick the brains of these experts that we have found who will help us understand and probably challenge us a little bit as well. So that's great. I want to quickly introduce you to the panel. Helen Clark, the Right Honourable Helen Clark, who probably needs very little introduction, was Prime Minister of New Zealand from 1990 to 2008, and has also had a huge impact on health in New Zealand, Helen. So it's lovely to have you here joining us in this another iteration of the health discussion and debate in New Zealand. Helen's been not only been working for the UN for a number of years, but has also now come back to New Zealand, got involved in setting up the Helen Clark Foundation, and now has decided that's not enough. She's gone away and picked up another huge piece of work working with the World Health Organization to review the COVID for the World Health Organization. So thank you so much, Helen. Do you want to just quickly introduce yourself and really just tell us why your referendum is important to you?
Thanks, Marion, and kia ora, everybody. I've kept myself extremely busy since coming home from the UN 3 years ago. And one of the causes I took on was becoming a member of the Global Drug Policy Commission, and I've recently become the chair of it, actually, just before the WHO asked me to come and do something else on top of many other things that I do. But as a commission, we advocate against prohibition. We think prohibition of drugs has caused an enormous amount of harm. We are very conscious of how discriminatory the effects of prohibition and law enforcement following that have been in our own country, with Māori up to 3 times as likely to be arrested, charged, convicted, jailed for these kinds of offences. Same issues in the United States of America, where the issue against prohibition has been taken up by the Black Lives Matter campaign. But overall, what I see as prohibition leading to a lot of people having their lives totally unnecessarily blighted by being caught up in the criminal justice system. And with respect to cannabis, we all know this is a very widely used social drug, recreational drug in our community. Who among us wants our relatives, our whānau, our friends to be caught up in the criminal justice system because they made that choice for social use rather than, say, alcohol, which is more harmful to individuals and the society. So yeah, I've taken on the cause at the global level, and I'm very happy to help the Yes campaign here, because I think it's a once in a generation opportunity to get this right on cannabis in New Zealand. And I really hope Kiwis will rally around, you know, the campaign and say prohibition is failing us. It's failing our young people, failing Māori, failing everyone. We waste endless resources on trying to police prohibition to no good effect whatsoever. So let's get real.
Great, thank you very much. Our next panelist is Joe. Joe's the director of the Christchurch Health and Developmental Study. Joe is a social psychologist who's worked in the US and UK and Australia before coming to New Zealand. Most of the people watching this webinar will be very familiar with the longitudinal study. It's been a key source of information and data and evidence for the development of many of the way that people are working with, or hopefully will influence them around the way that they work with mental health and addictions. But so Joe's really focused on the psychosocial. This is the buzzword of the moment, on the consequences of cannabis use and abuse and dependence and mental health. And so a lot of the questions are around this, Joe, so it'll be really good to have you. So thank you very much for joining us. And just want to introduce yourself very quickly and say why you're interested in why the referendum is important for you.
Chiara Mary, and hello to everyone out there on Zoom. It's probably worth noting that I haven't been a social psychologist for a long time, simply because I've been running this psychiatric epidemiological study now for a while, and I've been involved with it for 15 years. And studying this longitudinal cohort and looking what's happened to them over the course of their lives, many of them having been involved in cannabis. In fact, one of the great thrills in my life was actually having Helen talk about the statistics that I generated personally in a meeting last October. So that was quite exciting. I've also, and it's probably worth noting for this particular audience, before I went to graduate school, I actually spent 3 years working in residential mental health just outside of Boston. So I was working in a residence and working with folks with quite severe and relatively intractable mental health problems for that period. So I have a bit of experience a long time ago in that area, but this is really important to me because what we've illustrated with our cohort over the years has happened in a regime whereby cannabis was illegal. So when we say that 80% of our cohort have tried cannabis at least once, that's where it's illegal, and this prohibition law was supposed to stop them doing it. And we found that when people were arrested or convicted, that 95% of them went on to continue their cannabis use at the same level, or they even increased their use. So having the force of the law applied to you actually didn't deter people. And the law is clearly, as Helen mentioned, discriminatory. We found that Māori were 3 times more likely to be arrested or convicted of a cannabis offense. So the social harms are really being directed to one particular group in our society, and you can't have a workable law that is operating at that level of bias. So those are really the main reasons why this is so important to me. And again, I fully echo Helen's comments. I think this is a once in a generation chance to do something much more sensible.
Right. Okay. Great. Thanks, Joe. It's good to have you here. Tuari, it's lovely to see you as well, joining us from wherever you are. And many of you who have been around the addiction services for, or particularly alcohol services for some time, will know Tuari in terms of his role previously at ALAC, you've done lots of work, haven't you, around various places in justice, in health and education, and have been around as a long-term advocate for change in this area. So yeah, thank you for joining us. And would you also like to introduce yourself a little bit and just say really, again, the same thing. Why is the referendum important to you?
Kia ora, e mihi atu tēnei kia katoa. Koutou I whakarongo mai hook, tēnā rā tātou. Ko Tuari tēnei, e mihi atu kia koutou mai hoko nui, kei tō e pāna me no reira tēnā koutou. Kia ora, thank you for that introduction and for inviting me on to be a part of this panel. A small sapling amongst these mighty tōtara trees that surround me. Yeah, look, I have been around a while, and I think longevity as much as anything. The two things I guess that really drive me though are personal experience, I think, and an absolutely unshakable belief that what we're doing now doesn't work, doesn't help anybody, and in fact makes things worse. So first things first, I gave up using alcohol and drugs just over 30 years ago. So I've had a lot of first-hand experience of all drugs, including opiates, methadone, a lot of cannabis back in the day. Then I ended up for quite a while working in the helping sector, a Māori alcohol and drug worker, mainly around Christchurch and Canterbury, worked in the prisons, ran a Māori program at a residential hospital at Helen Springs, and just need to acknowledge Whaia Pukakawawihi, who was one of our po, who passed away last week and buried yesterday. So I do have personal experience that I bring to the table, as well as having worked with people who have alcohol and drug related problems. And I believe very firmly that criminalising people, putting them in jail, giving them penalties, doesn't help anybody. As others have alluded to, particularly Helen, the way the current law is applied is racist, and you can talk about unconscious bias and all sorts of things, but actually it's applied, in my view, in an absolute racist fashion. That needs to change. That's just not fair. But also I do believe that cannabis can cause harm to some people, but and I think that regulation will improve and increase the chances of people who need help being able to get it. There'll be more treatment available, better education programs, more prevention. It'll come out from under the shadow of illegality, and we can address it head on as we tackle many other issues that are in front of us today. I think it's time for change. And as others have said, I think this is a once in a lifetime opportunity.
Thank you, Tuari. There's some really key messages coming out here, this once in a lifetime opportunity, and I think that's something that's probably worth keeping on thinking about. So Carly, can you introduce yourself as well? Carly has been absolutely awesome helping us to get this event going. So, you know, ups to you and the foundation for helping us. I think it's really great when community organisations and peak bodies like ourselves can actually work across. I just think that thing about collaboration is really critical. So thanks for that. Carly is the Policy and Advocacy Manager at the Foundation, at the Drug Foundation. And Carly has such a huge knowledge about the legislation and has been really supportive in terms of trying to get key and important evidence-based messages out to New Zealanders. So Carly, can you just introduce yourself and say why this is important to you?
Tēnā koutou katoa. Nā mihi nui ki a koutou katoa karanga mai mihi mai. No Otipoti ahau, ko te whanganui a tāra te kāinga, ko Carly Mercier toko ingoa. I'm Policy and Advocacy Manager at the New Zealand Drug Foundation. We've been around for more than 30 years now. We're a charitable trust, and our focus is really to reduce the harm that drugs can cause in New Zealand, drugs and alcohol. And one of our key platforms over the time that we've been in existence is to really get the narration or the way we look at drugs to shift that conversation from a criminal justice approach to a health and social approach. And that is why I'm really excited about this upcoming referendum, because what we're actually doing is, I guess we're putting our money where our mouth is, and we're actually trying to implement a system that will do just that. So we won't be punishing people, instead we'll be actually providing a whole framework within which we can try and reduce the harm that cannabis does cause to some people. And we're going to actually also be getting funding through that model to actually adequately treat treat the issues that do come up, and to do prevention work and education work. So that's why I'm really excited about this this referendum, personally and professionally.
Great, thank you, Carly. That's good to hear. Well, look, let's get started. If I just explain how it's going to work, for the first sort of 25 minutes, we've got some structured questions that we've already been asked. We're going to have cover about 4 different areas. So there's the bill and the impact that will have on public health. There's the global perspectives and learning from Helen's experience about what's actually happening in other places where things are, what's happening in other countries. The criminal justice and Māori perspective as it relates here in Aotearoa, and then youth and young people. So that's how we're planning to do it. Keep the questions coming through the Q&A, and we'll also have time to ask some other questions that people have raised, and also questions that people are raising on the chat and on the Q&A at the moment. So what I'm going to do is, Carly, ask you to start in terms of just shaping us up in terms of what are some of those key issues that we should be thinking about, and what are some of the things, and I know you've talked about it a little bit in various forums, but just run us through those key issues again.
Okay, so the key thing for me about the bill is that it has a harm reduction focus, a public health approach. So what it's trying to do, and I'd say it's world leading in many ways, it's trying to learn from our mistakes with how we've regulated alcohol, how we've regulated tobacco. It's looking at other countries that have regulated cannabis, and it's put in place a model that I think will work really well for New Zealand in terms of reducing some of those harms that cannabis can cause. And just to reiterate what Joe said before, cannabis doesn't cause harm to most people who use it. It's like alcohol. Most people can use it in moderation without much harm to themselves or family. It's exactly the same. Cannabis is not hugely harmful to most. However, a small cohort of people can be harmed, and that tends to be young people, people who start early in their life, people who use heavily, people who use frequently. And so the bill has really been created with those people in mind to try and reduce the harms to them. Which is exactly as it should be. And if what would be fantastic to see is that this actually ends up being used as a model for how we regulate alcohol in New Zealand, because we're not doing a good job of this. But I think the model that has been put here is a really thoughtful one, and alcohol can learn an awful lot from it. And just to run through a few of the really key things in the bill. Firstly, a really strict age limit of 20, so it remains illegal for people under the age of 20. One really key thing is that it's not going to be further normalising cannabis use. What we have is a pretty normalised use already in New Zealand, with about 600,000 people using last year. But the bill is really careful not to make that more normalised in the way that, for example, we do with alcohol. So there'll be no alcohol, there'll be no advertising, there'll be no billboards, there'll be no sporting sponsorship, that kind of thing, as we see with alcohol. So if you walk along the street, you won't actually be able to see where the cannabis shops are. Probably they'll be standalone cannabis shops, but they won't be able to advertise outside. They'll just be able to have a small picture of a cannabis leaf outside. So that's all that you'll actually be able to see of them on the street. You won't be able to buy it in, say, for example, supermarkets or dairies, just these standalone licensed stores. And in fact, licensing will happen from seed to sale. So every single thing you might want to do with cannabis will be licensed from that public health model to make sure we minimise harm and minimise the number of people who use. There'll also be no consumption in public spaces. You'll be able to use at home. And you'll be able to use in certain licensed venues, which will have quite strict rules around those. For example, no alcohol will be able to be consumed in the same spaces. Also, from a public health point of view, there's, and I'm sure Joe might talk about this later, in terms of potency, that's one of the things that correlates with not such good outcomes for young people if they use higher potency substances. So there's a potency limit, which will be determined by this new organisation called the Cannabis Regulatory Authority, and they'll base that on what's currently being used in New Zealand and what's felt to be the safe limit. So trying to keep that limit down. All products will be labelled. You'll know what's in your product. There'll be quality controls. There'll be health warnings on all the products. And this is a really key one. There'll be taxes taken. There'll be a specific levy pulled out from the sales, and that will go towards the Cannabis Regulatory Authority, which will be responsible for putting in place a harm reduction strategy, which will cover things like education, prevention, treatment for cannabis-related issues. So we know that we will be getting this money allocated specifically to cannabis harm reduction, which is for us quite exciting. And the final thing will be that prices will be controlled by levying those taxes to make sure that the prices don't fall too low, because if prices go low, we know that people are more likely to use, especially younger people, and they make sure they're not too high either, because we don't want to put the black market, we want to make sure that people go to the regulated market rather than the black market over time. Yeah, so that's a basic overview of the bill.
That's fantastic. And then if we have any other issues, we'll come back to you about that, because I'm sure people will be mulling that over as they're watching. So I'm sure there'll be some questions coming up from the Q&A about that. Helen, can we go to you now? I mean, one of the things is, anecdotally, we're hearing all sorts of stories about what's happened in other jurisdictions where legalisation has occurred, and really interested to know whether or not they are, whether in your view they can be transferred to Aotearoa, or what some of those issues are internationally. So if you could talk a little bit about that, that would be really helpful for us.
So on the issue of cannabis legalisation, like just about everything else these days, there's so much sort of hashtag fake news, isn't there? And people do a Google search, all sorts of things will come up. But on what happens when you legalise, there's no evidence that suddenly you have a huge rush of people going out to buy cannabis at a local store. Some of the studies show in some places it's gone down a bit. It might, maybe a small number of people might try it, but there's no evidence that suggests there's any sustained surge in use whatsoever. And actually some of it, as I say, points to even a drop, which might be that once fruit's not forbidden, it's not quite as interesting. Who knows what's going on here? But I think those who are watching the webinar should rest assured that this legalisation will not lead to any blowout in use at all. And one of the points I often make in talking about this is it's not a referendum on whether we make cannabis available in New Zealand. It is available in New Zealand. The problem is it's available through an illegal economy. If you want to buy it, the chances are that you'll either be buying from a gang or a step removed from a gang or organised crime. You want to keep young people away from that as well. And of course, in terms of the bill, we're talking about over 20s and overs, because under 20 you can't legally buy under this, and that's for good reasons. So you can't, on the international evidence, predict any surge in use at all. What it does do is bring the issue into the open, that here we have this very, very commonly used social drug. Up to 80% of us may use it at some time in our lifetimes on past practice. And if we legalise it, we can then deal with the issues around it up front, as we do with tobacco, as we do with alcohol. And Carly's right. This is what you might call a bespoke approach to cannabis regulation. This is a very carefully designed bill, and it's taken into account the experience with alcohol and tobacco. And it said, let's not even start there. Let's not let this be a major industry that can promote use. And one of the things that will mitigate against any increase in use here, I think, is that it's so clear that the product cannot be advertised and promoted. You know, I was the minister who brought the first smoke-free legislation through Parliament. What we were battling was a major industry which could sponsor your local kids' sports clubs. You know, we're starting with this cannabis regulation with none of that. Licensed shops, no advertising, no promotion, clear health messages, a commitment to put funding back into, you know, good health education about drugs in general. I mean, I think it's just a no-brainer that this is the way to go for New Zealand. Take it out of the criminal justice system, make it an issue that we look at through a health and social lens, and not expect any major surge in use at all. In fact, you know, I'd be very surprised if a year or two in we're seeing any increase at all.
Thank you for that. So it's very reassuring to hear that from the experience of other countries. Tuari, with the issues around the criminal justice system, and particularly for Māori, in your view, how will the bill improve the criminal justice outcomes for people?
I think, well, obviously by reducing you know, there being fewer arrests, fewer convictions, fewer people going to jail, fewer fines being imposed on Māori in particular, but on everybody. Less police time being spent hiring expensive helicopters to fly around looking for bits of pot, when they could be focusing on other things that may be causing a bit more harm in our communities. Yeah, but having said that, I mean, obviously it's not a magic bullet. The issues in our justice system are not going to be fixed by this single yes vote in September. However, these changes occur incrementally, and I think this is something positive heading in the right direction that can make a difference for a lot of people. I think there's, you know, as has already been said a number of times, and Helen put it very nicely when she talked about it's not about whether or not we want it to be available, it already is. I think that's really hard for people to understand just how available cannabis is now. That 80%, as Helen said, 80% of us have tried it at least once in our lifetime, some a lot more than that. And most, for one reason or another, have decided not to use that often. Some have left it in the past and they prefer other ways to alter their mood. And that's absolutely fine. And so I don't think, as Helen has said, I don't think there's going to be a huge upsurge in people suddenly wanting to go and try and use cannabis because they already have. I think what will change is, I think the illegality and criminality, the way of the current system, does stop people from asking questions, from getting help. It stops decent education and prevention measures from being implemented, because it's very easy to just sit back and go, oh, well, it's illegal, so just don't do it. And if we do anything around harm reduction or prevention, it's perceived by some as being promotion of the behaviour, which is, you know, frankly, it's just intellectually lazy, some of the criticism that's come. But so look, we believe, and I believe that obviously, you know, taking it out of the criminal justice system and having a more health and well-being focused approach is going to make a big difference. And it's also important to note, once again, just how ineffectual the current law has been. Saying no, telling people not to do something just hasn't worked for anything ever. And it sure hasn't worked for this. Drugs are now cheaper, more widely available than they've ever been. And this is after 45 years of the war on drugs. So, you know, I think there's, having said that, you know, I also get that people are concerned. And often people are worried about youth, young people, brain development and all those sorts of things. And again, it need to stress the fact that it's out there now. It's everywhere. And the difference is that we have an out of control, unregulated market. We have a market. And what we are proposing is a regulated and controlled market. So, yeah, like I say, it's not going to be the magic or the silver bullet, but I think it's going to definitely take us quite strongly in the right direction to where people who need help can get it, quicker and earlier, and that we can get in sooner to give people advice and education, because there are some people who should be warned, or who should be advised not to use cannabis.
Yeah. Okay. Thanks, Tuari. That's a very nice segue to Joe. And Joe, one of the things that we've heard that the relationship between young people's mental health and cannabis use, and particularly a risk of schizophrenia, risk of psychosis, demotivation, all of those things, and that's been a constant refrain that's gone through the discussion around the young people and the use of drugs, particularly cannabis. So, from your research in Christchurch, what can you tell us? How dangerous is this to young people?
How dangerous is it? That's a really multifaceted question, or requires a multifaceted answer. If you look at some reports from overseas and things like drugs harm indices and things like that, you would probably conclude overall that it's not particularly harmful. Also, for example, a Lancet paper a couple of years ago came out and said alcohol was actually the most harmful in terms of its pervasiveness across societies, the levels of use and problems associated with that. But we should note that rates of cannabis use in New Zealand are particularly high. So we're something like 9th in the world for cannabis consumption at the moment. And that consumption tends to be concentrated amongst younger people. So if we're talking about the harm that's actually associated with the drug itself, more of that is going to be concentrated at younger ages. And the simple reason for this is that the reason the drug works on us is because we have an endocannabinoid system that exists in our central nervous systems with receptors for the different cannabinoids that appear in the plant. And this is just a result of evolutionary pressures over millions of years. But this actual system wasn't discovered until 1992. It was the first time it was reported on. So it wasn't really very well known. People thought, oh, well, people take cannabis, it does something in the brain and these things happen. Now we know that this endocannabinoid system, but the system is in a constant state of fine-tuning itself. And a number of scientists believe that it doesn't actually settle until about the age of 25. Meaning that if you're bringing in cannabinoids into your system that aren't part of your normal body chemistry, you're going to be doing something to alter the operation of that system. So that's really the pathway by which these mental health harms are thought to arise. But again, most of the research suggests that these things are relatively rare, may only occur in people with a specific genetic predisposition, so particularly psychosis. And what we do know about the pattern of psychotic symptomatology from our own study is that most of the symptoms that people who are more regular users of cannabis at younger ages report more symptoms, but their symptom pattern, and I've had a student working on this for the past couple of months, the pattern of symptoms isn't any different from what you would see in non-cannabis users, just that they report more of them. So really, there's a sort of garden variety. I sometimes have thoughts that other people do not share, and those sorts of symptoms, and not the heavy end of hearing voices or having hallucinations when they're not acutely intoxicated. So I suppose the answer is mildly dangerous at younger ages, and if you're using more heavily, which really, again, has been brought up as one of the reasons why this legislation is being brought to bear, that is trying to keep it away from young people. Now, I know there's a lot of concern out there too about many cases where you see people report that they know someone or they've seen someone or worked with young people who have used cannabis, and then their lives have deteriorated from that point. It's important to note that in any individual case, it's really tough to disentangle that specific effect of cannabis on that person, when the fact of the matter is, if you're starting younger and using more heavily, you're also likely to be using other drugs. So as an example, we did a paper about 12 years ago now where we looked at cannabis and ADHD symptoms in people who were 24 in our cohort when they were 25. And the people who were using more cannabis were more likely to report ADHD symptoms. But then we figured other drugs into the mix, and we discovered that it wasn't actually the cannabis, it was the other drugs they were taking that were the pathway to issues around ADHD. So I think it's really important to take into consideration the individual's history, not only with respect to cannabis, but the fact that cannabis might put them in a position to be using other drugs, which leads me to a third point, which I'll try to dispense with very quickly. We found evidence in our own cohort for a cannabis gateway effect, whereby if you were younger, when you started using and using more heavily, you're more likely to use other illicit drugs, which sort of brings this into the equation. But it's notable, for example, that in the Netherlands, where cannabis has been decriminalized now for 46 years, since 1974, they actually didn't find this gateway effect, simply because if you want to use cannabis there, you don't actually have to see a drug dealer to get it, and you're less likely to socially find it in the circles that you're traveling. So it could very well be that any cannabis gateway effect is actually a byproduct of prohibition and the fact that you have to deal with drug dealers or your friends who interact with drug dealers. And it may be that that gateway disappears once cannabis is legal.
Thanks, Joe. You've covered off a number of the questions that have come through on the chat and also on the Q&A about the gateway effect. I want to go on with some of the other questions that have emerged. One of the things that comes up, and it's come up in the chat and it's come up in previous questions, is the relationship between smoking, smoking tobacco and smoking cannabis. Many of the organisations that are probably listening have and are participating have been strong advocates of smoke-free, of supporting people with often chronic and enduring mental health issues who are still smoking at the same rate that the rest of the population was in the 1950s, and have done lots of work in terms of trying to reduce cigarette consumption and move towards that smoke-free goal. I'll start with you, Helen, because that was your legislation, you know. What do you see as the correlation and as the impact, and what's the evidence telling us about that?
On mute.
Incidentally, at the end of August, there is the 30th anniversary of the smoke-free legislation, which I took through the New Zealand Parliament as a young Minister of Health. So that's a big anniversary, and what amazing progress on smoke-free since that time. But here's the very important point. We never sought to reduce tobacco smoking in New Zealand by banning the product. What good would that have done? It would have handed tobacco over to gangs and illegal supply. They would have got very rich on it, because tobacco is an extremely powerful and dangerous addictive drug, and not easy to get off, as many people probably even among those listening today will know. So the whole approach to the tobacco smoke-free New Zealand was to get the health arguments out there, and to get arguments that resonated with different communities. I always remember when I was PM and Tariana Turia was Associate Health Minister, and she brought to me some smoke-free advertisements which had been worked on with Māori focus groups and communities. And the one that really hit home, and you may remember it, Peter Sharples, I think, saying, "I want to see my grandchildren grow up." People saying, you know, it's about whānau. The kids saying, I want granddad to see me grow up, you know. So through very important social messaging that resonated group by group, we've been successful. If we'd tried to ban it, forget it. You know, it would have become forbidden fruit. Legal economy would have got rid of it, and so on. Now, I remember when I was Minister of Health and making the arguments about the importance of having health promotion on reducing tobacco. We used to use a figure of around a quarter of the people who use it will die of it. I think the estimates of that have now gone up to closer to half. It is very, very dangerous to smoke tobacco. And if you look then at any of the international evidence on what are the harms of the range of substances that are out there, tobacco comes out as vastly more dangerous and harmful to human health than cannabis, vastly. And then you look at alcohol, which, as Carly said earlier, we don't actually regulate particularly well in New Zealand. We could do much better on alcohol, and we do have binge drinking and other issues here. But alcohol also comes out as more dangerous to human health and to society than cannabis. I think it's important to note that the reason for cannabis being illegal and tobacco and alcohol being legal is entirely historical, and actually really has its roots in colonization and what was legal at the time that the UN drug conventions came in, who had the power. The reality is that tobacco and alcohol were well established in the global north, which held a lot of power. There are many societies where cannabis has long been part of life and practice. For example, its use as ganja in traditional Hindu ceremonies. So the reasons for it being illegal are merely historical. They have no basis in science. And for those who are interested in that particular angle, the Global Commission on Drug Policy, which I'm now chairing, has a very good report on its website on how this prohibition of cannabis has no scientific basis at all. So there we are. I'm not one who promotes smoking cannabis. I'm someone who's had a background of asthma as a child. Smoking for me is just not something that is sensible at all. I don't advocate it. But what I see is the far greater harm of prohibition, of criminalization, than the harm of use. And I think that if we can get the referendum through, then we can have realistic public health promotion around what the issues are. And as I've said on other webinars and interviews, so many New Zealanders have used cannabis. They know that their teeth don't go green, their hair doesn't fall out. I mean, this is not a horror drug. It is something in very common use, and we need to be realistic about it.
Thank you for that. It sort of cues into another run that's come through from the questions, and which is sort of a bit, maybe you, Carly, is the economics as well. And someone has said, I hear rumours about big tobacco rebranding through cannabis. Is this a risk? And you've already talked about the kind of the market that exists there and being controlled by the drugs, the gangs previously. So, Carly, do you want to have a shot at that?
Sure. I mean, I think it is a risk, and it's a risk that we've seen in America specifically happen. We've seen big cannabis growing over there, and it's because we know that it's a risk that we've been able to put into the bill a whole bunch of things to stop that being an issue here, learning from our mistakes previously with alcohol and tobacco here as well, of course. And so some of the very practical things that they've done have been to put a cap on the grow licensing so that no more than 20% of the grow licenses can be held by one company. Another thing that they've done is to split up the growing and the selling licenses, so you can't be both a producer and a retailer, which is aimed specifically at trying to shut out any one person or one company taking over the market, like a McDonald's or whatever. Another thing they've done is they've put aside a portion of all licenses for small-scale growers, which would, and part of the reason for that is to try and undermine the black market that we currently have. As we know, that's made up in large portion of small-scale growers, and we want them to be able to come into the legal market and to get licenses. And so there's going to be a portion of licenses for them, of the total cap. There'll also be a total cap on cannabis that can be grown in any 1 year, and licenses will be allocated across the market based on that cap. And the idea is that over time that would sink. So we'll be producing less and less cannabis. That's one of the goals stated in the piece of legislation. And And then other things like making sure that we don't have any advertising is hugely important. Preferential licensing for companies that want to, that are non-profit companies that want to retail. So for example, if you're a harm reduction charity, you might want to set up a retail outlet so that you could specifically reduce the harm from cannabis in your community by giving people good health education, pointing to them to ways that they can use less harmfully, that kind of thing. So what we'll hopefully see is a not particularly commercial model in New Zealand. I feel quite confident looking at the bill that the things I was particularly concerned about in terms of commercialisation have been really well addressed. For example, there's like 8 pages or something of rules around not advertising, not using logos, not finding sneaky ways to advertise. And they've taken that from Canada, which has had some trouble with companies finding different ways to advertise and sponsor events and things. So I think that the legislation addresses those issues, and no doubt there'll be things over time that we'll have to tweak to make sure that, you know, we keep on top of that. But I think we're in a very different position than we are with, say, alcohol, where over time we've had a very permissive market and we've had to pull that in and rein it in, and we've done that with the alcohol lobby kicking and screaming the whole way through. What we've got here is we've got a prohibition model, and people are very keen to keep that strictly regulated, and so we're starting from a much different starting point, and I think it will be quite a different outcome here for cannabis.
Yeah, thanks, Carly. And one of the questions that a theme, if you like, of questions coming through is about education and information. I mean, someone's quite worried that older people who will be voting in the referendum don't understand and have been very much influenced by their fear in the past of drugs being illegal and something that's not that they shouldn't be voting on. So what are your views about this? Because it's you know, it's a complicated subject, and how do you think we do that education? I was interested there, Helen, you said about Minister Tariana Turia and her sort of personal taking on of some of that. I mean, do you think that we're doing that well, or do you think we have to wait until after the referendum to begin to do that work? Tuari, what do you think in relation to Māori particularly?
If I could just say a word on Tariana, I mean, she was fantastic on this cause, and still is. I mean, and we were able to get the messaging right on tobacco because she was so clear that the messages that resonate with Pākehā aren't going to resonate with Māori. And the work was done to see, well, what would resonate with Māori? And it was so important to get that right, because the rate of death by lung cancer for Māori women is the highest known such rate of any population in the world. So, you know, getting it right was critical. And I think the same with public health messaging when it develops along with legalization on cannabis. It will be very important to see, you know, what messages resonate with what groups, and it will be different. I mean, on tobacco, for example, it was found that with Pākehā, if we're consistently showing horror messages of blackened lungs and limping around with emphysema and so on, we tend to say, oh, you know, not us. But it was the whānau family messages that resonated with Māori. So I think, you know, we need all the smart research we can get to support, you know, people to make sensible and informed choices, right? And even with all the information around about tobacco, there's still a proportion of the population that's smoking. But you know, just make it relevant, make it real. And with cannabis, it will be a question of not trying to make it seem like a horror drug of the kind that tobacco is. It's got to be realistic messaging. Tuari, come in.
Yeah, I think it's important to note too that there have been a couple of surveys done around Māori views towards regulating and legalising, and the latest one 2 or 3 weeks ago had Māori 84% of Māori supporting law change. I don't think that's a coincidence, and I don't think that's an aberration. I think there are some absolute reasons for that. The most obvious one is that we know what's happening in our communities. We know who's being penalised currently by the way this law is being applied. There are a whole bunch of people in this country who don't care. They don't give a damn. They don't care if Māori go to jail or we get arrested 3 times more for the same thing. It's of no interest. That really bothers me, and I think it is for a lot of Māori it bothers a lot of us that this is just quietly bubbling along, and no one apart from us seems to know about it or care about it. So I think it's important when you're talking about education. Definitely, we know that the Māori population is young. Half of our Māori population are 24 or younger. There's less support for change in the older age groups, and we get that. I think one of the important things too, though, is that quite often what we come up against for the people who aren't keen on change isn't based on evidence. So that doesn't sort of work, I think, for some people. It seems to be much more a moralistic, sometimes sort of religiously based perspective about what you should do, what you shouldn't do, and of course the arbiters of that it's often left to older people in communities to be the arbiters of what's right and wrong, as opposed to listening to what the evidence says. So our messaging is very clear. We want our population to be informed, and we'll do everything we can to ensure that people can get access to information they need, irrespective of which way they vote at the end of the day, as long as it's an informed decision. That's what we're asking for, and that's what we're hoping for. I think actually that a lot of Māori I've been speaking to and communicating with are absolutely on board, and they have been doing the research, and they know full well what they're voting for and why. So I don't know. I think, but you're right. I do think. I mean, there are a section of the population who it's very difficult to reach with education messages. But I do think, for people who want to try and find out some more information, it's out there now. It's just, making sure that people know how to access it. I've done a couple of lectures to the U3A groups in Dunedin, who are the University of the Third Age, elderly people. They've been amazing. And in fact, very, very proactive. And quite a few of them are interested, particularly in the medicinal effects of cannabis, as being preferable to some of the medications they're being given now. And also note that in one of the overseas jurisdictions where there was a slight increase in cannabis use, it was from over 65-year-olds. So I think, I think a lot of that information, once it gets out, once people are informed, they can, they'll make the right choice. But it's just breaking through that kind of moralistic, I think, barrier that some people have about, it's bad because people have said it's bad for the last 45 years. If they delve a little bit deeper and look at where the whole war on drugs came from, the racist background, the racist whakapapa of this legislation, it may change and does change some of their thinking.
Yeah, thanks, Tuari. I think there's such a lot of wisdom in what you're talking about, but I want to go to the other side of it. We talked a little bit about education and research and training. Let's go back to the other end, the regulatory end, because one of the questions that's being asked is about, look, as a sector, we understand what commissions and regulatory organisations do or often don't do. So if you think about, there's a harm minimisation aspect and a public health approach to gambling. But yet, in terms of regulatory impact, there's little. We've also seen the lack of teeth around some of the alcohol legislation, and the fact that community organisations have to end up protesting in streets about liquor stores rather than it being a genuine harm reduction approach. So, what do we think? I mean, this is probably more to Carly, Helen. What do you think about the teeth that the regulator will need?
You go first.
Okay. So there'll be a Cannabis Regulatory Authority, and the way the bill is drafted, it has an awful lot of power. It has controls over licensing. It has controls over how money is allocated to harm reduction. It has controls over education, potency, quality controls, how it's delivered and by whom. It has a huge amount of control to do what it needs to do, and what's more, money will be taken in a levy specifically to pay for that. And I think some of the downfall often, and Helen will be able to speak better to this than me, but some of the downfall often in terms of making sure good bits of legislation are well implemented is to do with how money is allocated to that implementation. And I'm very heartened by the fact that money is set aside specifically in the bill to put towards the stuff that needs to actually happen. So I feel confident, based on my reading of it, that it's going to have the powers and controls that it does actually need to make sure that we have a really good outcome.
Yes, I agree. And, you know, we've never had a tobacco control authority or an alcohol control authority. I mean, I think, you know, we're really starting, as I say, with bespoke regulation, that we have a whole regime around this, which should, you know, assuage any fears people have about legalization. It is very controlled. You know, I recall particularly towards the end of my time as Prime Minister, what a terrible problem it was to have all these alcohol outlets in our lower socioeconomic demographic communities, just, you know, pumping alcohol. You know, it's a problem today that with the fast food outlets, they tend to cluster on the path to school, again, in lower socioeconomic neighborhoods. Now, with the licensing regulation proposed under the bill, the Cannabis Control Authority is going to be able to say where these licensed outlets are. Can't be next to a school. You put rules around this. And I think if we can get this working, it'll give, you know, cause for thought about how we could actually tighten up on some of these other things. I'm a great believer, for example, that we need some regulation about where the fast food outlets are. That definitely need to be tougher around the alcohol outlets. So, yeah, a lot of people around the world are going to be looking with great interest at how New Zealand handles this. And if we can get a really good cannabis control authority that acts responsibly, which I'm sure it will, get the right staff, the right people in there, consult with communities, I think we can do this well. This bill is not the kind of free market approach that you see in some of the United States of America states. It is a Kiwi solution, but it's going to attract a lot of interest.
And just
Thanks.
to add into there quickly, Marion, the Cannabis Regulatory Authority will cover all this stuff, but there's also a Cannabis Advisory Committee which will advise them on key regulatory points, including potency and how licenses are allocated and things like that. And that body will be made up of people including civil society and NGOs, people representing young people and Māori interests. So I think that's something that we also haven't seen for that we know that we're actually going to get some really structured input from civil society into how that model actually functions in practice. And I think it will also be quite an agile model, because they'll have to look every year at, you know, things like license allocations and things like that, with civil society feeding into that conversation. So I'm really hopeful that that means we can have, you know, an agile, public health focused model going forward as well, not just when we start.
Yeah, and that's good, Kai. Just looking at the screen and the sorts of people that I know are watching this, you will get an engaged civil society, because this is a group of people, organisations, non-profit organisations that really care about this and really care that we do it well, and that we do it in a New Zealand way. I mean, it just seems as if we're battling history and other people's history. You know, we've taken on a story from other countries, and so I feel like that we have a real opportunity to do things really differently in Aotearoa. Look, the time has gone so quickly. I didn't realise we were cracking on here. I just want to really ask you just for some kind of really summary and summary thoughts about anything that's popped up for you as we've been talking. Joe, is there anything that you want to kind of just make sure that you get your point across to this group of avid listeners and lookers?
I'm reminded of the fact I took some notes that I didn't really say anything about potency in the previous previous Correro. Potency is a concern because what's happened historically over a period of time is that the potency of cannabis has changed such that THC levels have increased, whereas CBD levels have been bred out of a lot of plants. And one of the things around that is that as THC levels increase, you are probably increasing the risk of this action around psychotic symptomatology because you don't have a balance in the plant anymore. Because it's thought that CBD actually probably has some antipsychotic properties to it. So what could be improved under the proposed legislation is that you actually have first of all a limit to THC content, which can be tweaked presumably by the authority in reaction to changes in the black market and some preference for high potency products, but at the same time also consumer safety and consumer education around what they're actually using, so that they can choose to have the experience that suits them, and also that is safer for them. So I think that's one of the key things around this is it's actually knowing what's in what you're consuming. At this point, you don't know, first of all, whether it's pure or has been adulterated in some way, and secondly, what the combination of those cannabinoids are, which is going to play a role in your own health effects. Now I noticed that in the chat that somebody had said that noted that tobacco, there's not much mental health effect. Actually, I published a paper on this about 14 years ago where we found that tobacco use actually increased the risk of depression in our cohort. In fact, that the increase was probably greater than that for cannabis that's associated with cannabis use. Now that's actually a relatively weak effect. So there's an association between cannabis and depression, but we can't tell which direction it goes in, whether it's causing depression, and it might be a little bit, or whether it's people are using it for treating mild or moderate depression, which is probably a bit of that too. But actually cigarette smoking, and probably due to its constant sort of craving and satiety, actually does lead to an increase in depressive symptoms. As does alcohol. There's actually a strong link between alcohol consumption and depression. So we can't overlook the very commonly used drugs when we're talking about mental health effects.
Thanks, Joe, and thanks for your work. I mean, it's really critical that we have that hard evidence coming through, and also that it's New Zealand evidence, because I think that's another area that we kind of let ourselves down sometimes in terms of drifting off to what's happening in other places. So thanks for that. Tuari, have you got any sort of final kind of comments that you'd like to make? You've thrown the gauntlet down a little bit today, and I think that's absolutely timely in terms of the challenge to our health system, in terms of its approach to particularly to Māori. I guess all I really want to say, I mean, I've been thinking a lot about this, obviously, and I'm not sure that I'd be as supportive as I am if it was 15 years ago. If I was still doing the day-to-day work, and I've still got a lot of friends in the alcohol and drug sector, and they have mixed views, and I absolutely respect that, because they are still working day in and day out with people who are experiencing problems because of drugs. So I get, the reticence and the reluctance, but I still think, even with those concerns, people, the biggest concern I have, to be honest, is about the government, the regulatory authorities' ability to get it right. To be honest, that I think we can. This isn't risk-free. I guess that's what I'm trying to say. But we believe we've got the foundation and the building blocks in place to make it the best it can be, if we all get involved and make it the best it can be. I think one of the things I really like about the way the law is shaping up is that there are going to be opportunities for people, for communities, for whānau, for iwi, to get involved and create what we want to see, and not have it all done for us by others. So again, I just want to say, I absolutely understand that people have got question marks and concerns. However,
in my case and in my view, we've got to this is the time, we've got to make the change and then make it work and make it better than it is now for our whānau, and as I've said this a few times quite publicly, if you think about how you want one of your own to be treated, one of your kids, grandkids, one of your close relatives, if they develop a problem with drugs, including cannabis, then I don't think many people would be promoting and supporting a criminal justice approach. So, kia ora.
Kia ora. Thank you. Carly, have you got any just final comments that you wanted to make, or little ends you wanted to tie up before we conclude?
Yeah, I think one thing that we haven't talked about very much is stigma, and I think that's particularly relevant for the audiences that we've got signed in today, sort of community service providers. With making cannabis legal, that would dramatically reduce the stigma that's associated with using cannabis and with coming clean about cannabis use. So at the moment, if people have an issue with it, they're far less likely to talk about it and to go to seek help for that issue than they would under a legal market. And I think that that's really, really key for people, for this audience particularly, to know that people will be able to have conversations more with their family, will be able to do better public health education, health promotion, will be able to talk much more honestly and pragmatically in schools about cannabis use as well. It won't all just be about, no, you can't do it. It'll be about, some of you may try this, and here are the things to look out for, which is far more useful in terms of education and changing behavior than just telling people not to do something. In fact, we know telling people not to do something often ends in them doing it just specifically for the sake of it. So education, and I also think perhaps in schools, what I'm really hoping we might see fewer exclusions from school due to cannabis use, because schools will start to treat it in the same way they do alcohol, and they'll try and find another way of dealing with it other than just saying, no, you're out of here. So there are lots of little impacts like that, which I think are really key when you take away that stigma from a drug and start treating it truly as a health issue rather than a criminal justice issue. It sort of changes your whole attitude to how you deal with problems in society relating to that drug. So that was one thing. And the other thing I wanted to pull up on some comments in the Q&A about how what organisations can do to spread the word. So regardless of whether you're yes or no voters, please do use your networks to make sure that your people know that they need to be enrolled to vote, that they need to turn up to the election or do a postal vote, but they can vote just for the cannabis referendum if they want to. They don't have to vote for a political party, though obviously it's great if they get involved in all of those things. But yeah, see what you can do as networks to make sure that your constituents know they need to be enrolled and do actually get out and vote.
Thanks, Carly. That's great. And the final word, Helen, thank you again so much for joining us today. It's been huge for us to have you, giving your time and supporting this discussion. So just your final words and conclusions, really.
Well, thanks. And there's been some wonderful points made by all the fellow and sister panelists, and also questions coming through as well. Just what Carly said on schools and how they approach it. We'll all think of an example that we know of the young person, and there's a proportion of young people who don't get on at school very well anyway, and schools often, unfortunately, don't make a great effort to keep them in. So a cannabis offence can, or cannabis use can very quickly be an excuse for getting that kid out of the school. But then the slippery slope starts, doesn't it? You're pushed out of school, you then go down a slope of needing to earn the money to pay for the cannabis you want because that's the group you're with. Then you end up with an arrest and conviction, and then you find it hard to get employment, and then we all know that slippery slope exists. Let's try and stop this. If we can have a different approach to cannabis, I'm hopeful that will lead to a difference in approach in our schools and how they treat our young people as well. A second point to make is one of the arguments being used against legalisation is people say, oh, well, the Misuse of Drugs Amendment Act last year decriminalised, so why do you need to do this? Well, the facts just came out on the experience with the Misuse of Drug Amendment Act since it was enacted last year. And tragically, but actually you could probably predict it, the amount of arrests and charges for possessing and using drugs haven't gone down at all, even though the new law says the police should not arrest and prosecute for possession and use. They were given an out, and the out was unless it's deemed to be in the public interest. Give that discretion and it's all over. So the police are carrying on as they always have. And so there's still, you know, some thousands of arrests and prosecutions for use and possession. So, you know, that halfway house of decriminalisation just isn't going to work. It's not working. And because of the discriminatory way in which the system is using, you know, again, it's the young Māori in particular who are being picked up on this. That this just isn't right. We have a chance to get it right with legalisation and control as the bill proposes. And I really urge people to, you know, look at the arguments and to, you know, to accept that the greater harm is the attempt to prohibit the use of a drug far less dangerous than legal drugs already out in the society, and which is widely used. Let's get some controls around it. That's my plea.
Well, the feedback coming through on the chat and the Q&A has been phenomenal, and just absolutely acknowledging the panelists for coming and having this conversation and having a powerful and true conversation. So all I can do is thank you so much for joining us today. The material will be available on various websites, on the Drug Foundation, on Platform's website, so that we can pick up this conversation, and you can direct those people that you know that need to hear this to those places. So thank you so much for joining us, and thank you to the Drug Foundation for working with us to make this event possible. So thank you.
Thanks, Marion. Have a great day, everybody.
Thanks all.
All right.